there's three bloodborne viruses, HIV, hepatitis B and hepatitis C, and they all effectively treatable. However, the outcomes with treatment are very much dependent on early diagnosis. So, for example, with HIV, the mortality in the 2 years after diagnosis is about 10 times higher than if in someone with late diagnosis than someone who's diagnosed early. And the problem and frustration for me as an infectious diseases physician is still seeing people regularly presenting late with these bloodborne virus infections, where we could identify that they should have been tested, several years earlier, but weren't tested. So the idea we came up with was a sort of nudge system based on an electronic health record that would prompt GPs or doctors to do these tests. The system is effectively a way of looking at the risk factors in the health record and putting up an alert on the screen when the patient's there in front of the doctor saying, consider testing for these viruses. We thought that if we were shortlisted, it would be a great opportunity to showcase our idea and network with people or companies involved in this sort of product in the Northeast. It was also a great opportunity to talk to the AHSN, and indeed, since we've got the award and done the pilot project, we're now actually working with the AHSN, having got further funding to develop the product.
The award has been an additional motivator to complete the project successfully. Regarding system progress, at the time, the BBV test front existed as an idea. Since then, the test front has been developed as an add-on to System 1 and has been tested in a trial in Northeast England. Innovation is important because it allows us to develop new technology and ways of working and rigorously evaluate innovations. We are currently working with the Academic Health Science Network on a follow-up industry-funded project. The Health Award can be a great way to demonstrate independent recognition for your innovation. It can also be a motivator and an advantage when you apply for further project funding.
It's pretty clear that innovation and research is essential in the health service, and we've seen, particularly in the last 18 months with the pandemic, that how much innovation has really made a difference, and it's enabled us to carry on treating patients in very different circumstances, and enabled us to really change the way we work in lots of positive way. And I think we do need people, healthcare professionals particularly, to think about how can they do their jobs better, how can they provide better care through innovation. And in our case, it was how can we use digital innovation to provide better care for patients.